Hello, my name is Melissa Hlavacek, and my topic is the use of phenylbutazone in racehorses. I will start with some basic information about phenylbutazone. Phenylbutazone, commonly known as bute, is a non-steroidal anti-inflammatory drug. It reduces inflammation and acts as a pain reliever. It was first approved for racing by the state of Colorado in 1959 and was legalized in most states in the 1970s. Phenylbutazone works by inhibiting the enzyme cyclooxygenase, which is responsible for the production of prostaglandins. Prostaglandins are responsible for the inflammatory response. So, by inhibiting cyclooxygenase, the inflammatory response is prevented. However, cyclooxygenase is also involved in the healing of skeletal tissue via the inflammatory response. When cyclooxygenase is inhibited, skeletal tissues can be harmed. The effectiveness of phenylbutazone has been widely studied since its introduction in the 50s. A study by Foreman and colleagues in 2008 examined the effectiveness of the drug. 8 quarter-horse mares were used, and 4 were fitted with adjustable heart bar shoes on their left front legs. These shoes apply pressure to the frog and create artificial lameness. Lameness scores were taken every hour on the horses in the 4 trial groups, which were lame with phenylbutazone, lame with the placebo, sound with phenylbutazone, and sound with the placebo. When phenylbutazone was given at the standard clinical dose of 4.4 milligrams per kilogram, it profoundly reduced the lameness scores of the lame horses. Here is a graph of this study. Both groups of sound horses, whether given phenylbutazone or the placebo, had lameness scores of 0 throughout the trial. Lame horses not given phenylbutazone had lameness scores around 4 during the trial. Lame horses given phenylbutazone originally had lameness scores similar to the placebo horses, but after phenylbutazone was administered at 1 hour, their lameness scores significantly decreased to about 2. Their lameness scores did gradually begin to increase towards the end of the trial as the phenylbutazone wore off. This shows that phenylbutazone was effective in reducing the lameness scores of the horses fitted with the heart bar shoes. Over time, phenylbutazone has become more controversial due to incorrect usage by some racehorse owners and trainers. It was originally intended for training purposes only. Phenylbutazone allowed a horse to continue training with a mild injury or return to training faster after an injury. Now, phenylbutazone is often given so a horse can continue racing with a mild injury. Today, many people within the racing industry use phenylbutazone as a diagnostic tool. If a horse appears to be in pain or has mild inflammation, a trainer will give phenylbutazone to see if it alleviates the pain or inflammation. If the horse seems fine after phenylbutazone administration, many owners determine that the injury is minor and that the horse does not need to be seen by a veterinarian. However, just because phenylbutazone seems to alleviate the pain does not mean that the horse should not be seen by a veterinarian. A veterinarian can correctly administer medications so that the horse becomes sound, which reduces the risk of further injury. Many veterinarians consider NSAID use justified, but are concerned because they cannot accurately evaluate a horse's degree of lameness after a horse has been given phenylbutazone. Many veterinarians agree that phenylbutazone can mask unsoundness in horses. The regulatory veterinarians responsible for pre-race examinations have stated that they wish to examine a horse pre-race without the possibility of an NSAID interfering with their examination. This presents a moral dilemma for racetrack veterinarians. Will the medication simply relieve mild pain, or will it contribute to further injury? One study concluded that higher concentrations of phenylbutazone and other NSAIDs did contribute to higher incidences of injuries on the racetrack. Like many other NSAIDs, the use of phenylbutazone can be dangerous. There are many reported adverse effects with NSAID use in horses, with ulcers being the most common. Horses also may exhibit weight loss, have a poor coat, or show repeated signs of mild colic. Horses can be given anti-ulcerative medications if there are signs of ulcers, and some veterinarians actually prescribe an anti-ulcerative medication regularly when giving phenylbutazone. Overdoses of phenylbutazone are extremely dangerous and can be fatal. In a study by Hugh and colleagues in 1999, 4 horses with ulceration of the right dorsal colon were studied. All had recent phenylbutazone use, either in excess of the recommended dose or in excess when it was combined with other NSAIDs. 3 of the 4 horses of this trial did not survive due to severe right dorsal colon ulceration, which is a common site for ulceration in horses overdosed on NSAIDs. Also, in a study by Aleman and colleagues in 2011, 2 horses were evaluated due to blood in their urine. This followed prolonged administration of phenylbutazone at the correct dosage. Phenylbutazone was suspected to have caused ulceration of the urinary bladder, resulting in bloody urine. So these are the urinary bladder mucosas of the 2 horses following prolonged phenylbutazone use. A and B are of a quarter horse at the initial examination and at a follow-up, 25 days after phenylbutazone treatment was stopped. C is a thoroughbred at the initial examination. Both horses' bloody urine were resolved when phenylbutazone treatment stopped and a synthetic prostaglandin was given to help repair the damage. So the use of phenylbutazone continues to be an escalating controversy within the horse racing industry. Its use may be justified in some situations, but can also be questionable in others. No drug should ever be given as a diagnostic tool to see if a problem resolves itself. Though generally safe when administered properly, the possible dangers of the use of phenylbutazone are well documented throughout the history of its use and include death in severe cases. Though most of the racing world outside the U.S. has banned the use of phenylbutazone on race day, the U.S. has continued to allow it, despite growing public concern. Only time will tell if it continues to be allowed in the U.S. on race day.